Hi, today we are going to see about the top 10 NCLEX preparation mistakes. You have to avoid this if you want to crack the NCLEX and the first go. So, we are going to see the things which we need to avoid. The first one is studying too much of content and too little of questions. This doesn't help you in any way. So, the mistake what we are doing is we are watching endless lectures but really doing nothing like practice questions. So here, how can we fix this? We can fix this by making lot of practice with the questions, that is 60 to 70% of questions, and content review can be done at least 30 to 40%. Here we tend to forget lot of rationals which is coming with their wrong answers, but I would tell that we need to emphasize more on the rationals. Then we will be coming to know where we are going wrong, why the answer which we are selected is wrong. So this will help you to fix the mistake. And second thing is ignoring next generation NGN question types. So we are only practicing the old style MCQs, which will be coming only 30 to 40% of the questions. So nowadays the trends are changing. So most of the questions are coming from the NGN question base. So these are many question types which are being included nowadays. Those are case studies, matrix type, bow tie type, highlighting the questions, SATA, and which is nowadays having with the partial credit. Before this NCLEX, the SATA, that is select all that apply, used to have mistake. But nowadays, this type of SATA, even if you are correcting 2-3 mistakes, we are going to get a partial credit. So this is a good news. And so how can we fix this? By practicing engine type questions. Like every day we have to have at least 1 to 2 engine question type practices when we are preparing for our NCLEX prep. So next thing which we need to fix is we are memorizing without understanding the mistake. Why? So we have to always question why part of the question. So learning answers, mnemonics, memorizing facts without reasoning doesn't make any sense. So always NCLEX wants the safest practice. That is the safest action is right now. So how we can fix this? We can fix this after every question. Ask why it is correct and why are the other answers wrong. By questioning to yourself, we can arrive to the correct answers. So this is also an important aspect to be seen. Next, what is the mistake we need to be fixed is not mastering the priority and safety concepts. So see the ABCs. These are the very important. We always skip by learning the old style and method of the MCQs. So we have to emphasize the ABCs, the Maslow's hierarchy, the safety and the infection control, which are most often frequently tested in this new generation NCLEX series. So reality, always NCLEX will never skip this topic. So we need to go through these questions very nicely. And we need to get clear with these concepts, and we have to try to crack these type of concepts and with the answers. And how we need to fix this mistake is we need to master these topics. Mainly, we need to see the ABCs, and I have already said acute versus chronic, stable versus unstable, and least restrictive with safety. Safety comes always first. These things if you are monitoring, then we can achieve this correct answer, and this will help us in progress in our NCLEX journey. The next common mistake which we are doing is we are studying random topics without any plan. We don't have any particular plan how we have to go about. So the mistake is we are studying whatever which is coming to the mind without making any plan, and which will lead to ultimately confusion, and ultimately it will lead to burnout. So how we have to fix this? We have to have a structured plan. So we have to have a fundamentals, which is the most important topic. We need to get the basics. So this basics will help you in achieving many other topics and further in detail subjects like medical surgical, pharmacology, obstetrics, pediatrics, and those things we can daily review, and we have to cover the concepts by taking few daily questions so as to master these skills. So next is avoiding the weak subjects. We always think the subjects which are very difficult and we just avoid. So I would like to suggest that skipping these subjects was not going to help us on a long run. So we have to master those skills too. So it's like skipping pharma, or we are skipping the cardio, which is the ECG is the most toughest, and skipping the delegation. We don't have any idea regarding delegation, or the mental health will not help us on a long run. So we need to master these topics too. So NCLEX also never skip the questions from these topics. They always concentrate on these topics too. So it is like how we need to fix the problem is like we have to turn the weaker areas strong by just only one thing, that we need to practice daily, short practice, like at least 10 to 15 questions from each topics, so that we can get away from the fear that these topics are no more difficult for us. So we can even achieve in these topics and we can clear answering the questions with great success. Next is changing resources too often. We always do this mistake. Yes, you heard it right. The mistakes we are doing is like we are referring to too many resources just to thinking that it will help us in some other way. I will trust me, it doesn't help you in any other way. I always suggest that stick to one particular topic, so it will help you. At least you will be clear with the concept. Referring too many books, like we are overwhelmed and we are really confused how we will finish the topics. It's like if you are mastering only one particular or one or two books for the content and one or two books for mastering the question practices, that is more than sufficient to crack this exam. So always remember, consistency plays a very important role, which beats the quantity. As I said, we have to have the consistent practice daily. So if you are making a target in our mind with a proper consistent practice, which is always very important in cracking such type of exams. Next mistake we always do is that we are obsessing with over the scores what we are getting instead of concentrating on the improvement mistake. So here is the fix, like we need to see how much is the improvement we have attained rather than the scores. Getting upset with some low test practice scores, you heard me right. Like if you're getting very low scores in the practices, obviously you'll get demotivated. But the truth is NCLEX doesn't care about your scores. It is going to care about your thinking pattern and how you are going to answer the questions with using the proper critical analysis and critical thinking. So always is focus on, are your mistake is decreasing? Are you choosing the right answers and which is going towards the safety of the patient? This matters the most. And next one is studying without simulating exam condition mistakes. We always make a routine mistake, like studying, okay, we are going to study and we are going to fix some time and we are doing the usual study pattern daily with the same task and same thing, which is literally boring. I would suggest that if you have an exam simulated like pattern where you're not referring any books or not you're having any resources, you need to keep a time aside in a day just to see your progress, how much questions you are making correct and what is your progress. This will help you a lot on a long run, rather than referring books and answering the question by hearting things will not help you more. So it's always you have to make timed quizzes and you have to have some brainstorming questions. We should not have any pause. And after finishing all the simulated pattern of questions, you need to assess yourself, evaluate yourself, how far you have scored and what is your improvement. This will help you a lot. And last but not the least, we always ignore our mental health and this will ultimately lead to a burnout. You heard me right. So it's like we need to study. I would not say that you should study so hard that you will lose your mental peace. So it's like you need to have a break time in between your studies, and because if you're studying at a very long run and without any break, it will obviously lead to a poor judgment. So I would suggest you should take a break in every half an hour, at least 10 minutes break, walk, stretch yourself, listen to good music. And another important aspect to have a mental peace is that you should have a good sleep pattern. A minimum hour of 7 hours of sleep daily is very much essential for your mental boost up. So how to fix this is just we need to rest at least in a week, 1 to 2 days, taken off away from the books, go away, watch a nice movie or hang out with your friends, and so that you can have a break from the studying pattern. And study focused is like we need to study books, obviously we need to take a break in between, and a good sleep might help you. Listen friends, NCLEX is not about knowing everything. You can do everything, but you heard me right. It is about choosing the safety. It's like what is the safety for the patient. That is the most important in the NCLEX pattern. How you are a good nurse. It's not like an proper which is in the hospital setting. It's like how you are doing the patient safety. That is the most important. And with the limited information also you can crack this in a exam. So friends, this is the important thing which we are going to implement in our daily NCLEX passing journey. Thank you.